This is Chapter 7, Examination and Treatment Quality, Active Listening. Active listening involves a lot of things, including repeating what the patient says in their exact words, paraphrasing using a combination of the patient's words and your words to indicate that you're listening, and also reflection, which is using your words entirely to reflect the patient's statements. And sometimes this is important because patients, people in general, say things, but they don't always hear what they say until it's repeated back to them in these various ways. So it's an important technique to get the patient to pay attention to their own words, as well as to indicate that you're listening to them and to check your own accuracy. Active listening also involves not only listening and responding to the patient's statements and questions, but it also is observing behaviors and body language. So it really is a combination of using your eyes and ears to pay total attention to the patient. Among the things that you want to avoid doing, of course, is texting and talking, and occasionally we'll have students or residents who receive a text and will pull their smartphone out and respond to it, which I would not really recommend. It's just sometimes inappropriate and disrespectful. Also, active listening involves not interrupting the patient when they're in the middle of a sentence by using perhaps a rude gesture or indicating that you want them to talk faster. You want to really completely listen to the patient. Another way SPs can tell if you're not listening is you may re-ask the same question again and again because it appears as if you're working through a list of questions and not really listening to the response. So active listening really means that you want to listen to the patient and ask questions based on the patient's responses or the patient's statements.